In this morning's Flu Watch, so many people want the H1N1 vaccine, but the supply hasn't even come close to meeting the demand. And now the Obama administration is facing tough questions on the delay in preparing the vaccine. Our own Dr. Jennifer Ashton is here this morning with the latest. Good morning,
Good morning, Maggie. That's right. While lawmakers are expressing their concerns over the amount of time it's taking to get the vaccine to the public, schools and hospitals are taking their own new measures to ensure that the virus does not continue to spread.
In Washington, officials from the Obama administration told lawmakers they are doing everything they can to get the vaccine to people who need it. The government purchased 250 million doses of the H1N1 vaccine. However, only 12.8 million doses are currently available.
Our planning has assumed that there would be some gap period between when vaccine would be commonly available and when the flu would actually be present.
Short supply of the H1N1 vaccine has led to long lines across the country.
We wish we had more vaccine, but unfortunately, the virus and its production of vaccine isn't really cooperating.
The CDC reports that H1N1 continues to affect young people, and as Dean Reynolds reports from Chicago, schools are often breeding grounds for the virus.
The number of public schools closing due to flu fears is mounting. 198 schools now are closed in 15 states. Some 65,000 students are affected, along with about 4,000 teachers. And while school administrators would rather be safe than sorry, Education Secretary Arne Duncan says closing a school should be the very last resort.
The social disruption of closing schools is huge, not to mention the loss of learning opportunity.
But for many, health is taking precedence over education.
Across the country, hospitals are changing their visitation rules to protect the population that is most susceptible to the H1N1 virus. Hattie Kaufman is in Los Angeles.
Since H1N1 is so prevalent among young people, many hospitals are changing their visiting policies, basically saying kids under 18 stay away.
Not only is the hospital not the best place to visit if you're in a higher risk group, it's also a place not to come if you might be in the group that might be carrying the virus without knowing it before you get ill.
It's definitely not business as usual. As soon as I met the doctor and shook her hand, she used the hand sanitizer, just one of the many precautions in this age of H1N1.